Nicole Fuller, and I am a breast cancer exercise specialist. I would like to introduce you to my Lymphedema Exercise program for the prevention and management of lymphedema in breast cancer patients. It is so important that breast cancer patients be made aware of the risks of developing lymphedema after breast cancer surgery. Lymphedema is the swelling produced by an accumulation of lymphatic fluid in the tissue. Swelling occurs in the same arm on the same side as a result of damage to the armpit or the axilla. This is because of axillary node dissection, axillary node removal, deep radiation to the axilla, as well as other types of breast cancer surgeries and reconstructions. Lymphedema can occur under your arm, in your upper arm, your lower arm, and down into your hand. If left untreated, lymphedema can cause an infection, it can delay wound healing, and it can cause hardened fibrotic tissue in your arm. This can cause range of motion problems, it can affect your activities of daily life, and it can cause pain. Lymphedema can occur quite soon after your surgeries and even many years later, so it is so important to get moving as soon as possible after your breast cancer surgery. But most importantly, before you start or attempt any form of exercise, you need to first clear it with your doctors. I'm going to introduce you to some of my lymphedema exercises, and these are just simple exercises to help reduce lymphedema. And I'm also going to suggest deep breathing exercises and walking, because all of these just help to increase your blood flow and your circulation, which then stimulate your lymphatic system. Breathe deep down and then exhale. It helps to stimulate your circulatory system, and with the movement of your diaphragm, it gets your lymphatic flow going. So this is a great way to start off before you do your lymphedema, lymph drainage exercises, and your stretching. So you relax either on your knees, or you can sit with your legs crossed and close your eyes in a nice quiet place and breathe in through your nose, out through your mouth, deep breaths. You can do this as many times or as long as you like, and it really is relaxing and can help you even get into a meditative state. I am now going to show you the lymphedema lymph drainage exercises. So it's always important before you start any form of exercise to warm up. This can be done by just some brisk walking, even if it's on the spot, some marching, brisk walking, a little bit of jogging if you can, and then I will show you the beginning of the lymph drainage exercises. So get into a comfortable position with your arms, your legs folded, or even on your knees, to make it comfortable. Okay, and we're going to start with some neck stretches. So a little bit of forward and back, touch your chest. Do that 10 times, then side to side, also about 10 times. Then we're going to do stretch, so put one hand behind your back, other one on your head, and you hold for 5 seconds. Up, up, and you can do 10 on each side of those. Okay, then we're going to start with some shoulder shrugging. 1, 2, 3, 10 of those. And now we can do some shoulder rolls. Forward and then backwards. Now we're going to do some shoulder squeezes. So you actually pull your shoulders back and you can feel it working all the muscles in your back. Forward, squeeze back, forward, squeeze back, forward, squeeze back, forward. Okay, now we're going to put our arms up, level with our shoulders, and we can do some little circular movements with your arms. Do 10 on going one way and then 10 going backwards. And we can do some clicking of the hands to get your fingers moving. Do this in front. You can do some hand circles, forwards, backwards. You can lift arms as far as you can go. If there's any pain, don't do this. And you can do flicking with your arms extended as well. So you can feel all of these exercises work your back muscles from your neck down, your levator scapulae, into your shoulders, your rhomboids at the back, your serratus here where you've had, which is all affected by breast cancer surgery. Okay, now we're going to lie down. So you put your elbow out, your hand on your elbow, you bend your knees up, and you're going to stretch your arm out as far as you can go, as far as it is comfortable and it's not painful. And you can do 10 of these on each side. I'm going to turn back, knees up, and if it's uncomfortable, you can bend your arms. 1, 2, 3, 4, 5. Do 10 of those. Now we're going to stand up to move back. Okay, so now I'm going to extend one leg down, bend the front leg, and you move your arm over as far as you can. And feel it pulling, stretching your axilla. Also, just if it's too painful, don't extend too far, and you can bend your arm if it is painful. Just the other side. Also flexes your shoulders, your arms, and your axilla. And then we're going to do some kind of stand as legs bend, and we're going to do some extending your arms backwards, up, back, up, back, up. And you can do 10 of each of these exercises on each side as I've showed you. This is really great for stimulating your circulatory system and getting your lymphatic system going. And I hope you've enjoyed these exercises, and I'm going to continue with some more exercises for breast cancer patients in my next episodes. Deep breathing exercises are a very important part of your exercise program. Deep breathing not only helps you to relax, but it also can help manage and prevent lymphedema. When you take in deep breaths and you